Let me ask you something. How many times do you wake up at night to use the bathroom? Once? Twice? Or maybe even more? If you're a man over 60, you are far from alone. But here is the truth. Your everyday habits might be silently enlarging your prostate. In this video, I'll reveal 6 habits secretly wrecking your prostate, backed by real science plus easy, step-by-step strategies to stop the damage and even reverse some symptoms naturally. Stick with me, because by the end, you'll know exactly how to protect your prostate and reclaim your nights. I'm Dr. James Carter, a urologist with 35 years of experience. Many men think prostate problems are just an inevitable part of aging, but research shows your daily choices play a huge role. From diet to movement, sleep to stress management, even small changes can drastically improve your prostate health. I'll also share stories of real patients who made simple adjustments and saw their urinary symptoms shrink within months. Comment your city below. I personally read every comment and love seeing where viewers are watching from. First, let's talk anatomy. Your prostate is a walnut-sized gland located just below the bladder. It wraps around the urethra, the tube carrying urine from your bladder out of your body. As it grows, it compresses this tube, making urination slower or more difficult. Symptoms of prostate enlargement, also called benign prostatic hyperplasia, or BPH, include weak urine flow, urgency to urinate, frequent nighttime trips, feeling like your bladder isn't empty. Ignoring these early warning signs is common, but delayed action can lead to bladder or kidney problems down the road. Prostate growth is influenced by age, hormones, inflammation, and lifestyle. By age 60, roughly 50% of men experience BPH, and by 80, nearly 90% are affected, according to studies from Yale and Harvard. But here's the key. Lifestyle can accelerate or slow this process. Hormones play a huge role. Testosterone gradually declines as men age. Some of it converts into dihydrotestosterone, or DHT, which signals the prostate to grow. High DHT levels are strongly linked with prostate enlargement. Inflammation also contributes. Chronic low-grade inflammation can subtly irritate prostate tissue, causing it to enlarge over time. Things that trigger inflammation include processed and fried foods, excess sugar, red meat, sedentary lifestyle. The good news: anti-inflammatory foods can counteract this. Studies highlight that berries, leafy greens, nuts, fatty fish, and olive oil help reduce inflammation and maintain hormone balance. Harvard Health even shows men with diets rich in these foods have slower prostate growth and fewer urinary symptoms. Movement matters too. Sitting for long hours reduces circulation and alters insulin and hormone levels. Regular walking or light exercise keeps blood flowing and hormones balanced. Even 15 to 30 minutes daily makes a difference. Before we dive into the habits, let's bust some myths. Only old men get prostate problems. False. Symptoms can begin in the 40s or 50s. Early intervention works best. If I have prostate problems, I'll need surgery. Not always. Many men improve with lifestyle changes or medications, sometimes avoiding surgery entirely. Prostate problems are inevitable. Know they're influenced by diet, activity, sleep, and metabolic health. Habit 1. Poor diet. Processed, fried, and sugary foods increase inflammation and DHT. Swap in leafy greens like spinach and kale. Berries for antioxidants. Fatty fish like salmon for omega-3 salve. Nuts, seeds, and olive oil. Patient example: John, 66, swapped fried dinners for grilled fish and vegetables. Within 3 months, he noticed fewer nighttime trips and improved flow. Small diet changes compound over time. Habit 2. Sedentary behavior. Even men who exercise sometimes are at risk if they sit long hours. Sitting reduces circulation, increases insulin resistance, and impacts hormones. Tip: stand up every hour. Walk 50 minutes after meals. Aim for 30 minutes of daily moderate activity. Research shows consistent daily movement reduces BPH risk and improves urinary function. Habit 3. Poor sleep. Sleep restores tissues, balances hormones, and reduces inflammation. Men who sleep 7 to 8 hours have up to 40% lower risk of prostate enlargement, per the University of Utah study. Tips: avoid fluids 2 hours before bed. Cut caffeine and alcohol in the evening. Keep your bedroom dark, cool, and quiet. Better sleep equals better hormone balance equals healthier prostate. Habit 4. Metabolic neglect. Blood sugar, cholesterol, and blood pressure directly affect prostate health. Conditions like diabetes, obesity, and hypertension increase risk of BPH and urinary issues. Tip: track your numbers, reduce sugar, and refine carbs. Exercise and manage weight. Patient example: David, 72, focused on walking, reducing sugar, and tracking his blood sugar. Within 6 months, his urgency improved and flow strengthened. Habit 5. Ignoring irritants. Caffeine, alcohol, spicy foods, and fizzy drinks don't enlarge the prostate, but they irritate the bladder. This triggers urgency, frequency, and nighttime trips. Tip: reduce or eliminate these, especially after 5 p.m. Replace coffee with herbal tea, alcohol with water, soda with sparkling water or infused water. Habit 6. Delaying doctor visits. Many men wait until symptoms are severe. Early checkups allow for monitoring, lifestyle adjustments, and less invasive treatments. Simple exams, PSA tests, and ultrasounds provide peace of mind and prevent complications. Here's your full prostate protecting plan. Move daily, 30 minutes of walking or activity. Eat anti-inflammatory, prostate-friendly foods, leafy greens, berries, fatty fish, nuts. Sleep well -7 to 8 hours. Dark, quiet room, no late fluids. Reduce bladder irritants, caffeine, alcohol, spicy foods. Optimize metabolic health. Track weight, blood sugar, cholesterol. Check in with your doctor regularly. Early intervention is key. Mini challenge. Start with one habit this week. Track your urinary symptoms and see how your body responds. Consistency is key. A single healthy meal or day of exercise isn't enough. Long-term habits matter. Stress management is important. High cortisol impacts hormone balance. Meditation, deep breathing, or light yoga helps. Hydration is essential. Aim for enough water to stay hydrated without overloading before bed. Patient story: Michael, 69, combined dietary changes, walking, and stress management. Within months, he reduced nighttime trips from 4 to 5 to just 1 to 2. Small steps compounded into major relief. Remember, small, consistent steps protect your prostate and your quality of life. Start with one habit today and build gradually. If this video helped, hit like, share with a friend, and subscribe with the bell for more healthy life after 60 tips. Comment your city and which habit you'll start this week. I personally read every one. Your prostate will thank you, and so will your nights.